I'm going to tell you something really quickly about why urine output matters, why you monitor it, why your teacher keeps saying, hey, you need to watch urine output when you're not really talking about the kidneys. So it's expected to monitor urine output when you're talking about kidneys, right? However, you're going to hear about monitoring urine output a whole bunch more than when you're just talking about the kidneys. So I'm going to try and show you a really, really quick picture. I'm going to draw it on my board here. Hopefully it works. So your heart pumps blood out and it sends blood to your organs, right? So follow me so far. So your heart sends blood to your organs. So I'm going to draw your kidneys here. Here's my kidneys. So when the heart sends blood to the organs, that's called perfusion. Perfusion is getting blood and oxygen to those organs. So now blood gets to my kidneys, and my kidneys are in charge of deciding what's waste and the extra fluid that's in the bloodstream, and it's going to say, hey, you don't need to be there. So it's going to send the waste and the extra fluid out of the body as urine. I wish I had a yellow marker, but I don't. So blue is what you get. Okay, so anything that it wants to get rid of that's waste or extra fluid, it sends out as urine. So whatever it wants to keep, it sends it back up into the venous system. So keeping that in mind now, I'm going to talk to you here face to face. Keeping that in mind. Whenever you have vasodilation or hypotension, vasodilation, I want you to think of like a water bottle. When you squeeze this, so let's say you have a water bottle with half is filled with water. If you squeeze that water bottle and vasoconstrict, think of vasoconstriction, you squeeze that water bottle, the water goes up in the bottle. If you release that and let it open up and dilate that bottle, water goes down, right? Because gravity, on Earth we have gravity. So anytime you vasodilate with hypotension, blood with gravity gets pushed down, so blood can pool in the extremities. So if all the blood is hanging out and being pooled, is it then coming up? If it doesn't come back up to the heart, can the heart pump it out? If the heart can't pump it out, what changes with my urine output then? If I get rid of that and I'm not sending blood to my kidneys, can my kidneys make urine? Nope, it can't. So if you think of instances where there is a disruption in perfusion to the kidneys, for whatever reason, it's going to change your urine output. And vice versa, if you reestablish blood flow to your kidneys and send blood back to the kidneys, then your urine output can increase. So hopefully that helps. Things that are, if we just try to relate other things to it. If your heart's not pumping, let's say you just had a heart attack, that's why you watch urine output. Because if I'm not sending blood properly out of my heart, are my kidneys going to get perfused? If my kidneys don't get perfused, am I going to have good urine output? So see how that kind of works together. If I'm in shock, I have vasodilation or a lack of fluid or whatever the cause of shock is. If it's distributive, I have lots of vasodilation. If I have lots of vasodilation, gravity pools the blood, which means it's not coming back up to the heart, which means I can't send it to the kidneys, which means my urine output drops. And if you think about it that way, if you are treating shock, if we're just talking about shock all of a sudden, like if we're talking about that now, if you're treating shock, how do you know they're getting better? Well, if you start reperfusing the kidneys and the kidneys are not dead, right? If they're not totally damaged, they're going to start working again. And how do you know they're working again? Get that urine output. But if you're in that irreversible stage of shock and you've cooked those organs with all that lactic acid, a kidney that's damaged permanently is not going to make urine. So that's just how one example or a couple examples of why urine output matters to monitor. So hopefully that will make some puzzle pieces kind of click together. See ya.